Hello, my name is Hugo Layard Horsfall, a clinical research fellow in neurosurgery, AI and robotics, working at the National Hospital in London, UK. Thank you to the Ideal Conference for this opportunity to present our work evaluating the attitudes of the surgical team towards artificial intelligence in neurosurgery. Over the next 7 or 8 minutes, I will cover a brief introduction, objectives, the methods employed, our results, and some concluding remarks. To begin, what is artificial intelligence? Simply, it is the ability for a machine to make complex decisions in the context of uncertainty and to learn from those decisions. AI has significant potential to disrupt multiple industries and workflows, but particularly relevant to healthcare setting in how we diagnose and treat patients. For example, in surgery, AI has many potential uses, ranging from preoperative planning, intraoperative guidance, and surgical robotics, using a variety of artificial intelligence techniques such as machine learning, deep learning, and computer vision. Novel innovation is an essential facet within surgery, making sure innovation is transparent, reproducible, and safe is one of the cornerstones of the Ideal framework. A recent development of the Ideal framework is the Stage 0 preclinical evaluation of a new device or technique. This requires us to investigate the system, patient, clinician, and device perspective. Integral to the adoption of AI within surgery, we must first understand the clinician perspective on the perceived utility and benefit of such technologies. We therefore set out to evaluate the attitudes of surgeons and the wider surgical team towards the role that AI could play within neurosurgery. We performed a 2-stage cross-sectional survey. The first stage was an open question, qualitative survey to determine the perspective of the surgical team on AI within neurosurgery, including surgeons, anaesthetists, nurses, and operating room practitioners. We then performed thematic analysis to develop a second stage quantitative survey to assess the extent to which participants agreed and were comfortable with real-world AI application. This was assessed using a 5-point Likert scale. The Stage 1 survey comprised 4 main questions to give us a broad perspective. What do you know about AI and its applications in everyday life? What do you see as its roles within neurosurgery? What do you think might be the advantages of AI? And what do you think might be the disadvantages of AI within neurosurgery? In the Stage 1 survey, we had 33 responses and a wide range across the surgical team. The majority were aware of AI in everyday life. The first stage survey demonstrated the perceived benefits of AI within neurosurgery, but highlighted important limitations such as privacy, loss of human touch, and loss of surgical skill. From the open question responses, we performed thematic analysis that yielded 6 main themes: imaging interpretation and preoperative diagnosis, coordination of the surgical team, operative planning, real-time alert of hazards and complications, autonomous surgery, and finally, post-operative management and follow-up. For each of the 6 themes, we developed real-world scenarios, such as this one for imaging interpretation and preoperative diagnosis. An AI system is designed to analyze and interpret radiological images for identifying suspected lesions. A patient presents with persistent headaches and issues with balance. A plain CT demonstrates a well-circumscribed intracerebral lesion. An AI system interprets the scan and suggests a potential metastatic lesion. The AI system automatically books the patient a staging CT scan and an MRI to further delineate the lesion. It also suggests further management, such as steroids, and transfer to a tertiary neurosurgical center automatically. For each scenario, participants were asked if they agree with this use and how they would feel if involved with the case as part of the surgical team. This was quantified using a 5-point Likert scale. Our Stage 2 survey was distributed via an online platform and had 100 responses over a 2-week period. Again, we had a good distribution across the surgical team. Of the surgeons who responded, the majority were consultants, with the most common surgical specialties being oncology, skull base, and spine. For each of the 6 theme scenarios, respondents somewhat agreed or strongly agreed about AI utilized for imaging interpretation, operative planning, coordination of the surgical team, real-time alert of hazards and complications, and robotic surgery, as demonstrated by the first 2 bars of each segment on this bar chart. When asked how comfortable the responder would feel if involved with the case, if this application of AI was used, the majority of responders were either extremely or somewhat comfortable. Our study demonstrates that neurosurgical healthcare professionals believe implementation of AI could improve surgical workflows and support patient care. This perceived potential benefit is important, as positive general attitudes towards AI are postulated to feature in the overall acceptance of AI and their subsequent adoption. It also highlighted concerns about the loss of human touch and fully autonomous systems, which must be taken into consideration when developing such technologies. Lastly, of the 100 responders in the Stage 2 survey, only 17% had been involved with previous AI research, yet 36% expressed interest in using AI in their own practice, demonstrating a willingness to engage in AI research. Limitations of this study include the Stage 1 survey was performed in a high-income single academic neurosurgical unit, which might therefore limit the generalizability of the findings. Secondly, distribution of the scenarios via online platforms might introduce selection bias. To conclude, this is the first study evaluating the views of the International Neurosurgical Team and their attitudes towards the real-world application of AI in neurosurgery, and the first using ideal stage 0 methodology, evaluating clinician perspective of such technology. We show that there is an appetite for AI to be utilized within neurosurgery, but caution remains about autonomy and the ethics of such adoption. Thank you for listening. Thank you to Hanny Marcus for supervising this research, and thank you to our research group based in London.